94.1 WHRP, Tony in the morning and DJ Primetime 256 Wednesday. It is Wednesday, Wellness Wednesday with Dr. Whitney West. Good morning, Dr.
Morning,
West.
Dr. West.
Happy hump day.
Happy
Happy hump
hump
day.
day. And today we're going to get right to it with gut health. Now, this is something that many people talk about on a lot of social platforms. People are always trying to figure out how to get that stomach to go down and what causes people's stomachs to fill up and plump up. And I'm sure we're going to get to it. Dr. West, tell us about gut health.
So there's been a lot of studies recently regarding how the gut is, some people have called it the powerhouse of the body. So a lot of what happens with us starts with your gut. So you put in, if you ever heard the term garbage in, garbage out, right? So you put bad stuff in, it's going to show in your body in that way. Your gut is the example of that. So when you eat certain foods, you take certain medications, then there are certain processes that cannot happen or don't happen well if you're not putting the right things into your gut.
So that's why you find yourself dealing with the challenges of not having a six pack because of
So
poor.
those are kind of different things. So when
Okay.
we don't have a six pack, we have extra fatty tissue covering the muscles because we everybody has muscles. Some of them show more than others. But when we're talking about gut health, we're talking about what happens on the inside. So when you eat something, you swallow something, it's the process of breaking down those foods starts in your mouth with saliva and enzymes and things. Different processes happen. Goes through your throat, down into your stomach. Then a whole new process happens in the stomach, and then the food is broken down, and then it travels its way through the rest of your small bowel and in your colon, and then the waste is emptied out. Some people have issues with that process, right? Some people don't move their bowels regularly. That's a problem because we need the toxins to go. Some people do not eat enough of the right food so that when it's broken down, it's absorbed. Certain nutrients are absorbed at certain parts of the process. So if you're not eating the right things, then you're not going to absorb them, right? So you're not going to have them, and then those processes don't happen. When you take certain medications, that changes what happens in this process too. So things like antacids, right? You take antacids and the over-the-counter options for reflux, that changes what happens in your gut.
So how much does hormones affect your digestive system in processing food?
Well, so if you know anybody who's been pregnant, or if you've been pregnant yourself, you know that during the early part of pregnancy, you have trouble going. You have lots of abdominal pain and a lot of things going on when you're pregnant, right? So estrogen and progesterone both play a role in how your gut moves and what moves, how fast it moves, and that kind of thing. So when you have fluctuations in your hormonal system, then you'll have changes in how your bowels work.
Okay. We're talking to Dr. Whitney West, Wellness Wednesday, and we are focusing on gut health. And what about menopause and those type of hormones? Does that have any effect on your gut health?
So again, this is the changes, the fluctuations in the estrogen and the progesterone, and in addition to that, like your stress hormone levels. So if you're stressed out, then it's going to affect how things move or don't move. So the increase in stress increases your stress hormone. That changes how your body digests food, and then sets up a situation where you have inflammation, and then changes in your function, how you function. So what we want to do is make sure we're mindful of the things that are stressing us out. I tell my patients, because I deal with women, is that women manifest their distress in their belly. So they get GI complaints, nausea, vomiting, and then the other things, inability to go or going more than often. So we want to make sure that we're mindful, we're paying attention to those things that are causing us stress, and we deal with that. The other thing is that we want to get in good food because, and that means whole food, not ultra processed, not things with a lot of sugar, other chemicals. We talked about this in the past, in the previous segments. But things that you want to make sure that you're getting in is high fiber, and that means beans, whole grains, vegetables of all different colors, especially green leafy, and then things that are called pre and probiotics. Prebiotics are the food for the probiotics. So you want to get in foods that are, so probiotics, you can take a pill. It has billions of cultures, but what are the cultures of, right? So there are things that that normally live in your gut, that we want to be healthy and abundant. When we take certain medications, then that changes how much of the good, healthy bacteria live in our gut. So we can eat it in yogurt, drink it in kefir, eat it in kimchi, sauerkraut. Those things that are fermented are good probiotics. Apple cider vinegar, that kind of thing, those things. Prebiotics are the food. So that's what the bacteria live off of. Garlic, onions, bananas, those kind of things will help support the healthy bacteria.
It's Wellness Wednesday, and we're talking with Dr. Whitney West about gut health. Doctor, what are signs of gut imbalance?
Bloating, brain fog, you have sugar cravings, fatigue, acne. Again, and then it'll show that your hormones are out of balance as well. But and I just want to, most people don't know this, but we think that majority of the hormones are made in the brain. About 70% of our hormones are made in our gut. So if we don't have a good gut, and there's different words that we use to talk about how an imbalance in our gut, but a lot of people will have psychiatric disorders, and that just means just regular old, depression or anxiety, and that's not regular. I'm just saying, like not major things that require hospitalization, but just things that people have on a regular basis. Anxiety and depression is so common, but it could be related to how our gut is malfunctioning.
So, better intake of foods, maybe a little exercise for the stress, and that all will probably help with some of your gut health issues. But more importantly, talking to Dr. Whitney West. What's the best way to get in contact?
My website is www.westmdpc.com.
And your parting words?
Empower Wellness. It's a journey, not a destination.